Good morning, good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the Daily Medical Tidbit. What do I want to talk about today, very briefly? Is prostate cancer, not downplaying it by any means, okay, especially in the black population. It is one of the most commonly diagnosed cancers in men, all right, and the leading cause of cancer death. Remember that. Among blacks in the US, prostate cancer is about 60 to 70% higher than among white men. And mortality, death, is more than double. Okay? So, example, black men have one of the highest documented prostate cancer incidents globally. Right? The American Cancer Society says that black men are 70 to 110% more likely to develop prostate cancer and twice as likely to die from it compared to white men. Okay? So in terms of the relative burden, think about this. Among black men in the US, prostate cancer is a major contributor to cancer mortality. It's about 17% of cancer deaths, all cancer deaths. Right? We tend to be diagnosed at a younger age, 2 to 5 years earlier, with a more aggressive disease or higher grade of diagnosis. Right? And despite this high burden, screening uptake like PSA testing is modest and often lower in black men. Right? And there has been decline in PSA screening in recent years have disproportionately affected black men. So because of this disparity, many guideline groups and specialty centers, recommend early risk-informed screening discussions in men of African descent, beginning around the age of 45, rather than waiting until standard ages. I'll echo that again, around the age of 45, right? Prostate cancer behaves quietly in its early stages, right? And many men are asymptomatic. Okay? So, however, as the tumor grows and start invading the nearby structures, symptoms start to appear, right? Such as, we'll take it the lower part of the urinary tract because of where the prostate sits. You start having obstructive symptoms. So your hesitancy or difficulty starting your urination. Weak or interrupted urinary stream, increased frequency or urgency of urination, and also nocturia, which means awakening at night to pee, right? And then you still feel your bladder is incomplete from emptying. And then you find yourself sometimes straining to urinate. That's obstructive symptoms, right? That means the prostate tumor is now pushing on the bladder or the urethra, which is where the pee comes out, right? And if there is underlying BPH, benign prostatic hyperplasia, then you have a worsening symptoms that still needs to be worked up, right? As the disease advances further, you could have blood in your urine, you could have blood in your semen, right? A lot of pelvic discomfort, and then bone pain because prostate cancer spreads to the bone. It metastasizes to the bone, okay? And then obviously the weight loss and the other symptoms, especially back pain, your lower back pain. So we have to be aware of these signs and symptoms, and we have to also know that early stage is silent, right? And the early stages are discovered how? Through the PSA test, lab test, or the DRE, digital rectal exam, right? And we have to drop that, machoism. I'm not letting somebody stick their finger up there. It could save your life, right? So there's a lot of things that can be done that we have to be cognizant about, getting your PSA check, having your doctors do the digital rectal exam, and just getting the screening. And if you have start developing the symptoms, you know what? You might be a little advanced disease, but still get it checked. Don't dismiss it. Do not dismiss this because we're dying from prostate cancer. All right? So remember that. Remember the signs and symptoms. Remember the age of 45. And to the doctors, I'm appealing to you. I'm appealing to you. This is a crisis that we must pay attention to. We cannot have 60 to 70% of black males having some sort of prostate cancer. All right? And we can't have almost 20% of all cancers being that of prostate cancer destroying us. And we have to pay also attention to the environmental issues. All right? So we all have to be engaged in this. This is not an individual problem, right? This is a race problem, a cultural problem, right? A societal problem, and we must deal with it. I just wanted to put that out there very briefly. I got to move. Have a great day. Peace.